People's Station. Welcome to Community Health Dialogue, sponsored by North Point Health and Wellness Center. The views and opinions on Community Health Dialogue are not necessarily those of the staff, management, and board of directors of 89.9 KMOJ. Now here's your host, Clarence Jones.
Good evening, Twin Cities. This is your host, Clarence Jones of Community Health Dialogues, and tonight is another extended period that we have in terms of celebrating with the University of Minnesota Maternal Child Health Program. But also we have some other special guests here that we're going to be talking to a little bit later in the show. But we have Ms. Jill Farris here, who is with Teenwise, and she is going to be talking to us about Let's Talk, because this is Let's Talk Month.
That's right.
You know, last night I returned from Chicago from my 45th class reunion. And going back home, it just caused me to reflect on a lot of different kinds of things, realizing how much life has changed and happened for me. And glad to get back reflecting. But also having Jill on the program also caused me to do some reflection, because I remember as a young person in this field, before it was Teenwise, it was Moab. And,
it was, yeah.
Out of Moab, there were some very, very wonderful people that helped me to, they helped me to shape my worldview, but they didn't try to change my values, which is kind of a good piece, because, and we'll talk a little bit about that. It's very important in this kind of work that you have people that are really committed to making a difference in the world. And I think that when I think about my journey with in fatherhood and working with the community health pieces, Moab and Teenwise were very, very instrumental in terms of helping to shape me into the kind of person that I am. I'm very conservative, but they were still willing to talk to me. And I think that was the important thing about it. So, Jill, welcome tonight.
Thank you. I'm so glad to be here.
Well, why don't we start off by just explaining to our listeners what you do.
Sure.
And a little bit about Teenwise and the work that they're doing.
Sure. Great. Well, so Teenwise Minnesota, we're a nonprofit organization. We're based in St. Paul, but we're a statewide organization. So we work with people all over the state of Minnesota. We're focused on sexual health for young people. So we're focused on teen pregnancy prevention, supporting young families, and helping young people grow into sexually healthy adults. We have been around actually for almost 25 years. And as you alluded to, we used to have a really long and complicated acronym name called MOAP.
I still remember what it stands for.
Yeah, you are one of the only ones. It was a long name, and it was kind of hard to remember. And so we actually changed our name about 4 years ago to be Teenwise Minnesota. And not only is it easier to remember and easier to say, but we feel like it actually matches our values as an organization a little bit more. We really feel like we're not just about preventing pregnancy and preventing disease and preventing risk, but we're really about a holistic view of health, and that we know that teenagers are wise, and we want to help adults in the community and in the world be those wise adults that are there for teens when they need them, for these tough conversations and for the education that we know that they need to be healthy.
So October is Let's Talk Month.
It is.
And we like to talk. And so why don't you explain to us what Teenwise is doing with Let's Talk?
Yeah, Let's Talk Month is actually, it's a national campaign. It's a national public education campaign that happens every October. It's coordinated by Advocates for Youth, which is a national organization. But each state kind of does their own spin, their own different flavor in terms of what they do for Let's Talk Month. And for Teenwise, we really are just getting word out there, wanting people to have that conversation. We're really encouraging people to, so the whole month is really about promoting parent-child communication around sexual health and sexuality. And so you were talking earlier about values and how important values are. And we know one of the tenets of, I think, parent-child communication is that parents are really the best sexuality educators of their kids. We know that parents want to actually do this and talk about this, that sometimes they feel under-equipped, or that they're not going to be able to have that conversation. So we really feel like it's important to talk with parents and have parents know just how important it is, their role in their kids' lives in these important conversations. And as I said, we know that kids actually want young people, or young people actually want adults in their lives to talk to them about this. So sometimes as parents or as adults, we might think, oh, this is a really uncomfortable conversation, and I don't even want to go there. I'm not even sure if I can, say those words in front of my kids. And the truth of the matter is it is tough, and it's tough for both kids and it's tough for parents. But parents want to be able to do this, and I think kids want this information from their parents. So it's extremely important, and I think the really important takeaway is that adults really can be there for their kids to provide them with their values. That's the whole point of having communication, having good parent-child communication, is that a teenager, a young person, a child knows what their parent thinks. They understand what their parents' expectations are for them, and they're there to really help them, provide them with those values and those kind of morals and guiding principles to help them, do what's expected of them in terms of being healthy.
So what are kids really saying that they want their parents to talk about with them?
Well, I think the thing that we hear a lot is that so first of all, most young people, it's kind of hit or miss with sexual health education that they might get in school. So some young people might get really great health information in school. Other people might not get very great health information. But one of the things that they don't really get, and probably appropriately so, is they don't learn about values. They don't learn about that because they are learning about facts. Sex education and health education classes are teaching about, facts, anatomy, puberty, birth control options, communication styles, ways to say no, refusal skills. Those are all really great things, and we know that those are all things that young people really need to be able to be healthy. But schools and sex educators are not in the business of telling young people what to think about something. That's really their parents' and their guardians' role. And so that's, I think, where parents can really step up and really kind of be part of that conversation, is really talking about what they think about these issues and doing it in a way that's open and encourages conversation, doesn't shut anybody down, doesn't shame anybody or make anybody feel bad, but does it in a way that is showing that they're open to conversation and that they want their young person to come to them with questions and with tough issues.
So you laid down this challenge to these parents now about how they should be talking to their kids.
Yep.
Now, some of the parents that are listening to us are looking for some tips.
Okay.
So let's talk about what are some of the tips that you would say that during Let's Talk Month that they should be talking with their kids about.
Yeah. Well, I think that it's one of those things. So first of all, I think one of the best tips, and if you're somebody who has, a 14 or 15 or 16-year-old, you're probably going to say, this isn't very helpful what you're going to say, but the first thing I like to say is to start early and start often. So if you have these kind of conversations with a young person from the time they're a little kid, and you talk to them about their body, and you talk to them about strangers, and you talk to them about friendships and relationships, it's a lot easier to navigate a conversation about should someone be sexually active, or, is the relationship they're in a healthy one when they're 17 or 18 years old. So I always, tell people to start that conversation early and to talk all the time. And we kind of jokingly say sometimes about the talk, like, did you get the talk from your parents? And everybody remembers if they did get a talk like that, usually, because it was usually for a lot of folks uncomfortable, or they remember it as being something really pivotal for them. But it's not just a talk. It's not just one time. It's not just one conversation. It's a series of conversations. So that's kind of one tip I can give folks out there that are listening. I think another one is using what I would call teachable moments, right? So this idea of if you are watching TV with your kid and there comes on a scene that piques your interest, piques their interest, to talk about it, to say, what do you think about that? Or, whoa, did you see what that, I heard that this person texted this person this, and is that something that kids are doing in your school? Is that something that you're seeing? It sounds kind of silly, but, celebrities and the media are always doing things that young people are talking about and that are actually can be really good conversation starters for parents. And so I think don't worry about feeling kind of hokey or cheesy, like just go for it. And, if you're thinking about it, chances are very good they're thinking about it too. And, but just asking it in an open-ended way, to say, and you don't have to ask it, specifically about them. Are you doing this? Is this a thing that you're interested in? Just talk about it in terms of their friend group, their peer group, kids they know, kids their age. That's a good conversation starter and tends to be a little easier to kind of navigate than having a parent right up in your face asking you personal stuff about what you're doing or what you're thinking about doing. Starting with kind of thinking about their peer group can be another easy way for parents to start that conversation.
So if parents watch on TV, they see something that's kind of shaky for them, and they say, turn that off.
Uh-huh.
Okay, so you're suggesting that they don't say, turn that off.
Mm-hmm.
You're suggesting they come with something different. So you're going to have to give me some tools.
Yeah. So it's funny. I'm actually sitting here looking at a list of what I would call door openers and, as it says here, door slammers, right? So something like, turn that off, or why are you asking me that, or where did you hear that, is, I would say, in some ways going to maybe shut someone down or make them feel like, well, I just wanted to know the information, and now you're making me feel maybe a little bit bad about that. So I think the sentiment is right to say, shut that off, but I think the sentiment, you need to go one step deeper and talk about what's making you uncomfortable, or why it is that scene on TV, why you don't like that, or why you don't agree with that as a parent. So, if something's happening there, not to say shut that off, or, that's, making a judgment call about it, but to say, I'm really uncomfortable with this scene because of X, Y, or Z. What do you think about that? Or even just to say, what do you think about that? Is this the kind of thing, are people hooking up like this? Is this the kind of thing you're seeing? Is this kind of the normal way of doing things? Or, am I just old fashioned? I mean, I think that's cool to just be open, honest, and ask open-ended questions and let them deal with it, let them roll with it.
So where do parents get this information from? I mean, you're giving a lot of great tips. I'm sure that some parents are saying, like, where can I learn this stuff from? So what are you doing in terms of Let's Talk Month?
Mm-hmm. Well, Teenwise has, we have a lot of great resources and great resources for parents. And there's definitely great resources. I would say, Let's Talk Month, I think of Teenwise as kind of a vessel here in Minnesota for bringing this information to folks locally. But quite honestly, this campaign is a national campaign that is coordinated on a national level. And their website has tons of great information. So I would say people can go, it's advocatesforyouth.org. It's a great website that has tons of tips for parents, strategies for parents. And there are things that Teenwise is doing locally here, too. We have a curriculum, actually, that's called It's That Easy, which I know you know a little bit about, Clarence. And the curriculum is actually intended to foster parent-child communication. And it's actually a training for parent educators, so people who come in contact with parents, people who want to help parents have these conversations. And so that's something people can go to our website, teenwisemn.org, and check out the It's That Easy initiative. And we certainly are open for questions and feedback on that training. We love to roll that out for people and make those conversations happen, give parents real concrete strategies and tools to use.
Well, we're going to open up our phone lines for parents who might want to talk with you about some of these tips and tools you're talking about. The phone number here is 612-377-3456. Again, the phone number here is 612-377-3456. We've been listening to Ms. Jill Farris talking about Let's Talk Month and how do parents talk to their kids. And I'm hoping that the parents that are talking to their kids talking a little bit different than some of my parents did. So 612-377-3456 if you have a number. So why do you think it's such a struggle for parents to be able to talk with their kids? I mean, every parent wants their child to be healthy. They want them to make good decisions. They want them to be the best that they can be. But when it comes to sex, everybody's doing the birds and the bees. I mean, everybody's got their little ditty that they're singing and all those kind of things. But parents somehow make assumptions.
Yeah, I think parents. So it's an uncomfortable conversation or topic. I mean, not everyone is me and talks about this for their job and is really comfortable doing it. And even I am really comfortable doing it. And even I have conversations or moments where I think, wow, this is a really tough issue or a really tough conversation. So really the nature of the topic, is just such that a lot of us, as you were talking about, kind of were maybe brought up with a lot of kind of just hush hush or kind of shame around sexuality in our bodies. It wasn't thought of as something that was an okay thing to talk about, maybe. And it's something that has a lot of, people have a lot of values and opinions and kind of their own moral ideas around sex. And it's in that way, it's not as straightforward as, just the facts, ma'am, kind of thing. There's a lot of values there. And so I think that that's one thing that plays into it. And I think parents want to do a great job for their kids. And they don't want to, they want to be competent. They want to know what they're doing. They want to feel like they have answers. And I think a lot of times parents are a little bit worried, actually, that maybe their kid is going to say something back to them or have a question for them that they're not going to know the answer to. And the thing I always tell parents and really anyone that comes into contact with young people is that's actually perfectly okay. You don't have to know the answers. I would be shocked if everyone knew the answer to all things related to sexuality. The most important thing is that you can be an open and non-judgmental presence for young people in your lives, whether they're your kids or other people's kids. They can come to you, they can ask you questions in a way that isn't, you're not going to shut them down or make them feel bad about something that they've asked you. And it's okay that you don't know. The best answer sometimes is, I don't know, but I will find out. Or I will look that up for you. I'm not sure. That's an okay answer. Sometimes that's a better answer than kind of winging it and saying something that we think might be the right answer, and then truthfully it's actually not. So I think that those are a couple of things that are hang-ups for parents. Those are the two that kind of come to my mind.
So what is the real state of teenagers today? I mean, that it is important for us to have this conversation.
Yeah. Well, interestingly, in terms of our work and the work that we do at Teenwise, people might not know, and people often don't know when I talk to them, that the teen pregnancy rate and the teen birth rate is actually the lowest on record ever in our country right now. So we have done some amazing things, and our young people are making great decisions and being really healthy and waiting longer to have sex. And when they do have sex, they're using contraception more effectively and consistently. And that is amazing, and that is awesome. And we also know that there's a lot of communities that aren't experiencing these really deep declines, like I said, overall. So we know that in our state, African American youth and Native American youth and Asian Pacific Islander youth and Latina youth, all those youth actually have much higher rates in terms of comparing them to white kids. And the other thing that's really still a huge issue is sexually transmitted infections. It's really actually quite striking when you look at the information that the teen pregnancy rate has gone down at the exact same kind of opposite way that the chlamydia and gonorrhea rates have gone up. So I think some of our messages are working, some things are sinking in, and other things we're not, we're missing the mark, or we're not, that kind of whatever we're doing is not quite working. So there's still a lot to be done. We know that. The other thing I think in terms of sort of where teenagers are and why this conversation is so important is that to me, sexual health is more than about, great, you made it to age 21 and you didn't get anybody pregnant or didn't get pregnant and you didn't get a disease. That doesn't mean that you're sexually healthy. Maybe you avoided some of those major, things that are pitfalls that we talk about, but that doesn't mean that you know how to have a healthy relationship, or that you know how to communicate with your partner, or that you understand consent. So there are a lot of things that we can still be doing with young people. Yes, we want them to avoid being parents until they're ready for that. Yes, we don't want them to get sexually transmitted infections. And we also want them to be really healthy people. And part of being a healthy person is being a sexually healthy person. So that's why, and we know that conversations with parents directly lead to young people waiting longer to have sex, being better users of a contraceptive method if they do decide that they're going to have sex, and all kinds of things that aren't related to sex when young people are talking with their parents. Things like, better self-esteem, less problems in school, less drug use. So there's so many positive things that can come out of having a great communication and dialogue with a parent figure.
So we talked a lot about parents and their conversation with kids. What is the community's dialogue around this conversation?
Well, I think the community...
What could it be?
Yeah, I think the community obviously includes parents, and I think that the kind of messages that we give young people, I think parents are part of that. So to me, the kind of community response is the same thing as the adults that surround young people, whether that's parents or guardians. So I really think that, again, the conversation needs to be to talk early and to talk often, to give fact-based information, make sure young people know they know their options, they know their rights, they know their responsibility, and just to make sure that they know, I think, to know resources, to make sure that they know, clinics that they can go to, places where they can see, nurses or doctors, free or low-cost places, all that kind of stuff, I think can be part of the community conversation. I also think it's important to know that absolutely everybody can have a role. I think sometimes people feel like, well, teenagers, like I'm not the parent of teenagers, or, I don't know why it matters or why I'm part of that conversation. And we've certainly seen really great community responses from people all throughout the community in different parts of the community. So if you know a young person, or guess what? We were all young people at one point in time. Like, I think there's just a way that the community can respond to just be just supporters of young people, and just that we believe in them, and we have expectations for them, and those expectations include that you're going to be healthy and you're going to make good decisions.
So you're saying that this is a national program that's happening all over the country?
Yes. And
tell me some more of the things that Minnesota is doing in terms of responding to this Let's Talk Month.
Yeah, one of the things, so we definitely have a lot of, I think with social media, there's a lot going on now in terms of folks really doing a lot of shout outs on Twitter, and a lot of stuff, campaigns going on with Instagram, people really just talking a lot, trying to get parents, to be part of the conversation. I think people should be talking all the time, but October really is this month where we have a focus on, let's really focus on this and make sure that parents know how important they are in this conversation. So it's really just a matter of kind of continually letting folks know, whether it's people that work, with young people, or it's parents, that they need to have the conversation, reminding them of how important that is, and then giving them resources.
Let's talk more about the resources, because
Okay.
I think that a lot of parents are saying, like, okay, so where do I start?
Mm-hmm. Yeah. Yeah, it can be definitely a daunting task. And I think once you start looking, I think especially if you start with a reputable source and you start with something that's good and that feels like what you need and what you need to have, you'll just uncover more. So I, again, would really encourage people to go to Advocates for Youth website, advocatesforyouth.org. And you can also check out Teenwise's page. And we do have a For Parents portal on our website. So there's lots of resources there for parents. I think another great resource for parents, quite honestly, is other parents themselves. So a lot of times folks that have kids of a similar age, you kind of get together and you kind of commiserate a little bit, and you share strategies, and you think about how to support each other. And part of that is if you have, a network of parents or parents coming together. Not every parent is comfortable talking about sex, but many of them might be. And so if there's an adult in the community that is known as a trusted individual, somebody who has a lot of great information, being the go-to parent in terms of that can be a really nice resource for other parents. They feel like, okay, I can send my kid to this, parent in the community, and I know that they'll give them good information because I'm not as comfortable with this as I want to be.
Does Teenwise provide or support or help parent groups get together and educate, or? No,
it's not. That's usually really not the focus of where we are. We're really about providing resources to parents, but certainly. And yeah, I think it's one of those things. It's definitely maybe a little bit of a disconnect, quite honestly, in our field, is that so Teenwise works to support professionals and people that work in the field. There's a lot of people that are out there working to support our teens and working directly with them. You're right. You're kind of pointing out a lack of resources and kind of connection for parents. I do know that there's several of the ECFE groups. A lot of those groups have worked with Teenwise to go through the It's That Easy training to make them more comfortable, and parents really have gotten together through ECFE. So I think check out your local ECFE if they have things where they work with parents of teenagers. I am pretty sure they would be able to kind of coordinate a group like this and with this topic.
Other materials. What other kind of materials are available for people who might want to, find out more? I know you mentioned Advocates for Youth, but there's got to be some other kind of books or materials that would be of.
Yeah, there's a couple of, there's a lot of really great authors out there that write books, and they're usually, most of the books that we see are more for younger kids. There's a great children's author by the name of Robbie Harris, and Robie is her first name, and she writes really great books for kids, talking about books for little kids, talking about how babies are made, and her book is called It's Not the Stork, and she explains through that book through really great illustrations and text about how babies are made and about how reproduction happens, and all the way up through puberty, and all the way up through sex, sexuality, gender identity, relationships, communication. So those are great strategies. Those books are great. I know a lot of parents who will buy a book like that and kind of maybe leave it sitting out, or put it on their kid's bed, or wrap it up and give it to their kid and say, and you can even say, I'm not as comfortable talking about this with you as I wish I was. I'm trying to get better at it, but here's a book and check it out. And if you have any questions, I'll do my best to try to answer those or to be there for you. And that can be a good way. They can look at the book. They can decide if they have things that they want to talk to you about. You can check in with them and say, how's that book? Was it okay? Did you like it? That can be a nice strategy too. So ways to kind of make that conversation happen without you needing to shepherd it all the way along. You can give them a book and have them kind of peruse it that way.
You and I have known each other for a long time. So how has your job changed in terms of working with parents or working with educators around this whole issue?
Yeah. I think we're doing a much better job of really talking about sexual health as a part of health, and not separating it out as some other conversation that needs to happen. I mean, yes, we've acknowledged here today all of the maybe discomfort that comes around this issue, and that it's different in a lot of ways because of the values that are attached to it. But I think that parents are interested in making sure their kids grow up healthy, and that means a lot of different things. And again, I think that means sexual health too. And so I think just kind of I also think we have kind of a generation of parents now that are they do want to have this talk. I mean, I think parents have always wanted to be able to do this, but I think so the time when the teen pregnancy rate was the highest was 1991, 92, 93. Those people are parents at this point, and a lot of them are parents of teenagers, and so they saw a lot of their peers going through, dealing with pregnancies and dealing with babies when they were really young teens, and I think that a lot of those parents kind of saw the effects of that and how hard it was for their peers, and I think they're being more realistic about having these conversations with their kids. They know how important it is, and I'm just going to make a leap, but thinking that they probably wish somebody would have had that conversation with them, and so I think that's one big shift that we've seen, and we know that more parents are talking to their kids than 10, 15 years ago. It's still not where we want it to be, and we still want more parents to have that conversation. But in terms of what the research shows us, that it shows us that more parents are actually having this conversation. And when we think about why the pregnancy and birth rates have gone down, I'd like to think parents have a role in that, and that we can give credit to parents for their role in that conversation. Well,
we're coming to the bottom of the hour.
Okay.
And I want to thank you for your conversation. But before you go,
okay,
here's what I want you to do. I want you to share information, share a message to our community that's not politically correct.
Well, that's not politically correct. Boy, Clarence, that's like putting me on the spot in so many ways. Let's see.
Okay, but be straight with us. I mean, there are things that we need to know. I mean, but there are things that come out of your heart, out of your passion around this particular topic. So let's hear it.
Well, okay, I think I've kind of alluded to it, and I don't think it's politically incorrect, though, to say that parents have a super important job to do, and I think, your kids' health teachers, people in their lives, let those people do their job and teach your kids the facts, because that's what they know and that's what they're good at. And then you have a super important role to play that they are not doing, which is giving them values. And that's your job. And get to it, parents.
All right. Jill, I want to thank you for being on our show tonight. And Dr. Wendy, I want to thank you for helping Jill, inviting Jill with our work together to come on and talk to our parents. This is Let's Talk Month. It's time for parents to talk to their kids even more about the various issues that are going on. So thank you very much. And listeners, we want to thank you. We will be back with you shortly.
Looking to get your makeup done? Freelance makeup artist Nas has you covered, specializing in natural makeup, which includes color correction, highlight and contouring, blending, brows, and lash placement. For appointments and inquiries, Makeup by Nas at www.styleseek.com/Nas or 651-285-0198.
Oh, John.
Marcia, are you all right?
I just came back from the doctor's.
And?
He said little Johnny has asthma.
Don't worry, Marcia. We'll do whatever it takes to reduce the symptoms that trigger the disease.
Oh, John.
I'll wash his toys and ventilate his room.
Oh, yes.
I'll ask Grandpa to smoke outside.
You will?
I'll keep the pets outside.
Oh, John.
I'll do everything in my power to get rid of dust mites.
You're the best husband and father.
This is Hennepin County Commissioner Peter McLaughlin. Help the ones you love manage their asthma attacks. For more information on how to reduce asthma attacks, call 1-866-662-8822.
Marcia.
John.
This was a message from the National Association of Counties.
Oh.
Hey, Mom, why is the sky blue? Why don't animals talk? Why do dogs have wet noses? Why is an 11 pronounced 1T1?
Kids ask a lot of questions.
Why do I have a belly button?
But you don't have to know every answer.
Why is the ocean salty?
Because you don't have to be perfect to be a perfect parent.
Why are there 50 states?
There are thousands of children in foster care who don't need every question answered.
Why is pizza round?
They just need you. For more information on how you can adopt, go to adoptuskids.org. A public service announcement from the U.S. Department of Health and Human Services, Adopt U.S. Kids, and the Ad Council.
Omar's Tire Shop offers tires with complete mount, balance, and auto repair. Omar's Tire Shop is located at 2853 Columbus Avenue South and is open 7 days a week. For more information, 612-259-7099. That's 612-259-7099. Located at 2853 Columbus Avenue South. Omar's Tire Shop.
Hello, and welcome to Community Calendar. I'm Kim Haley. First on the calendar, the AABCA is celebrating the Silver Anniversary Gala and Survivors Ball, celebrating and honoring cancer survivors. It takes place Saturday, October 17th, 5 p.m. at the Marriott Minneapolis West Hotel, located at 9960 Wayzata Boulevard in St. Louis Park. The Men Up Club is for African American males in school or high school. They will help you with school, graduating, teaching manhood, or just having real talk about how to win the game of life as a young black male. The Men Up Club meets every Monday night, 7 p.m. at Shiloh Temple, located at 1201 West Broadway Avenue in North Minneapolis. For more information, Dean 651-895-5033. Pleasure Production is having free stepping classes every Wednesday, 7 to 9 p.m. at Falwell Park, located at Dowling and Humboldt Avenue in North Minneapolis. For more information, Malcolm Samuels, 612-388-2548. Children in America are experiencing all types of domestic violence. 9 out of 10 children who are exposed to physical or verbal violence may be watching negative television. Quincy's Fresh Beat Clubhouse is saying no to domestic violence by turning off adult animated cartoons during family time in the month of October. For more information, Donald Jackson, 612-306-5894 or Quincy'sFreshBeatClubhouse.com. Get the 411 on how to get your driver's license back at the Twin Cities Driver License Rehab, located at 734 East Lake Street in Minneapolis. They're open Monday through Friday, 10 a.m. to 5 p.m. and Saturday, 10 a.m. to 2 p.m. For more information, 612-367-4111 or 612-200-9615. If you or your organization has an announcement you would like to share with the community, bring it in to KMOJ, 2123 West Broadway in North Minneapolis, in the 5 Points Building, Suite 200. For more information, 612-377-0594. I'm Kim Haley. Have a good day.
89.9 KMOJ, the People Station.
Good evening. This is Clarence Jones. We're back with you. We're going to continue community health dialogues. We're going to kind of shift the subject just a little bit, but it's still about parents. It's still about kids. And we have in our studio tonight Michelle Freely, Guy Bowling, Trish Skophammer, I'm trying to do it right. And Mr. Anthony Tonsel. These are people that some of these people I've known a long time, at least 20 years. And they're here, and they're representing Ramsey County Child Support. And it's also a program that we want to talk about because it's also a way in which we are still finding ways to be supportive of families. And I think that many times when people talk about this particular topic, there's a lot of emotions and things like that. But there are some things that, some very positive things that have happened in the state of Minnesota, some very positive things that are happening in Ramsey County and Hennepin County and other counties around the state that are really trying to make it better for families and for children. So we want to welcome our guest tonight.
Thank you.
Okay.
Thank you.
So let's talk about why are you here? We've been talking about a lot of different things, but why are you here?
Well, I think primarily we're here because we want to raise awareness about what child support is, what child support isn't, the services that we provide, the services we don't provide, and to make sure that people feel like they can call and talk to us and ask their questions and get good answers. We want to raise awareness about our customer service efforts. We want to make sure that people know that there are options sometimes when things aren't going well with their child support case, that there may be options, and we need them to be able to communicate with us.
Okay. Melissa, talk to us a little bit. I mean, you and I have known each other for 12, 13, 14 years, and I have always known that you had a true passion for working with fathers and families, and that's never been a question in my mind about that. Tell me about what you're doing with child support in Ramsey County.
So I think some of the things that have been happening the last couple of years is, one, we've developed a partnership with a Father Project. We have folks here from Father Project, starting in March 2012, so we can talk about some of the things that we've done there. Another thing that we started in March 2013, I'm not sure why all good things are happening in March, but is we started extended hours and open house services. So the third Wednesday of every month, our normal traditional business hours are 8 to 4:30, and the third Wednesday we stay open from 4:30 to 7. So we have extended hours. You can come in, you can talk to a child support worker about your case, but we also invite in community partners that are there that can provide services. So we have Father Project, sometimes you have other employment folks who come in, and we also bring in volunteer attorneys. So these are not attorneys from our office, but these are private family law attorneys who volunteer their time, who can talk to parents, fathers, mothers, custodial, non-custodial, about the issues that they're having, whether it's about a child support matter, it could be about a custody or a parenting time visitation issue. But we know that legal barriers are one of the issues that fathers in particular face, maybe having access to their kids, or it could be a child support modification that we as a county can't do. And so that those volunteer attorneys come in every month and provide a really important service, and it's one of the things that I think is really valued. Our surveys show that that's really valued, and it's one way that we can try to bridge the gap. There's a lot of things that we can't do. We can't provide those attorneys themselves to provide advice. We can't provide jobs to people, but we really want to try to bridge the gap, because we know that there are a lot of barriers that people have to paying child support. A lot of people aren't paying child support not because they don't want to, but because they don't have the ability to. And so we really want to try to bridge that gap in different ways that we can, as well as providing increased customer service for folks. So we know that some folks, are working 9 to 5. And so one of the things we can do is try to provide access to our office during off-business hours.
Okay. And God, I've known you for 2 decades, man, so that's how old we are, or how seasoned we are. But you're still in the middle of the fire, man, around fathers. Yeah. Tell us, why are you here?
Part of it is just a passion of mine, considering I am a father. 2 of the most
grandfather.
Grandfather. Oh, see,
wow.
I'm telling you, do the season.
Exactly, absolutely. But a young grandfather. But yeah, my 2 biggest accomplishments is my children, my daughter 15, Avery, Diane, and my son David, who's 31, who has actually made me a grandfather a couple of years ago with my granddaughter Gabriella Ray. She's 2.5, and my new grandson, he's 4 months now. So
you're very proud proud of.
Absolutely, with pride, which is part of the reason I'm driven and passionate about the work, especially considering the struggle. I mean, the work is personal, the work is heavy, but also I'm here because I've learned over the many years, Clarence, we've done this work together, like you said, over 20 plus years, is that you can't do this work alone. You can't do this work individually, and you have to have a whole multitude of folks that are right there with you at the table collaboratively and doing this work together, because individually it's tough and it's challenging for the men. You don't often get an opportunity to hear the voices of the men, but you'll hear that this evening from one of the gentlemen that went through our program. But also at the same time, we just know that it works. It's a proven model. Collectively, we're working together to address the multitude of barriers that these guys have trying to be involved in their life of their kid, be it emotionally, financially, and what foundation you need to establish in terms of providing holistic services to these guys. And so part of it is I just continue to do the work, continue to work within the community, and continue to work with great partnerships like Ramsey County, who we've now been connected with for a couple of years. But we all have been in the movement for quite a while, but we just noticed it's effective, that it works.
Okay. Mr. Tunsil, why are you here? I've known you for a long time as well, so and I can vouch also for your sincerity about taking care of your babies.
Right. First of all, my name is Anthony Tunsil. I have a 19-year-old son, Moses Zod. And I'm a product of the Father Project. I'm a product of what the young lady was talking about in the beginning, Ms. Weiss, about the EFC, early education family classes. I took that, and then child support, and my story is just real simple, is that I came to the Father Project because I wanted to get my passport, because I offered a job overseas, making a lot of money, and that didn't happen, because when I went to go look for it, they was like, oh, you owe us some money. And my relationship with the child support agency has not always been amicable. I always had some animosity to them when the judge told me, you don't need to see your kids, just pay your child support. I mean, was nobody there to advocate for me? Was nobody there to talk to in the office about, hey, how do you go about this? Nothing. So fast forward today, child support has changed a lot, because now you can walk down there and you can talk to them. You can, you should pay a little bit, and if you can't, don't be afraid to call in and say, hey, I can't do it. And I think their attitude and their mind frame has changed since Fathers of 1996. And so the Father Project has taught me how to take all of that, what I've learned, and just to advocate for fathers. So that's why I'm here.
So, guys, getting back to you, I talked about the long time that we've been in this work. What has really changed that makes you more comfortable or confident now in terms of working with the child support system?
Well, a couple of things. I think our work with the child support system, I think it changed for them even wanting to be a partner in what we're doing and wanting to have a particular approach in how they work with men, particularly men as it relates to, child support. They're in this for, a couple of different things. And the whole paradigm shift has changed within the last 20 years in terms of their approach, And also they have great leadership with Vicki Tereski, who is the commissioner who really emphasizes really having that holistic approach and working with men. And it's not about just only locating parents, establishing paternity, establishing a child support order, then enforcing the order. She sees it, as well as child support sees it overall, is really putting these men in a position of stability, really addressing and identifying what their needs are, really looking at them as important and valued, and really trying to establish them to take care of themselves as men first before they can take care of anyone else. And so for me, it has changed significantly because child support stepped up to the plate, and they said they wanted to partner with nonprofit organizations and work with fathers to put them in a better position to be able to pay child support. But first, they have to focus on themselves and stabilize themselves, and then begin to look at the impact that they have on their children by not only paying for their children, but being emotionally connected to their children, because the long-term effects is substantial. So some of the challenges that when kids are born in households of where the mom and dad wasn't married, and you're talking about born into poverty, and as the young lady was saying earlier about all the challenges that come with that, well, a number of those things, fathers is part of the the challenge, but they're also the solution to that challenge in terms of they're involved and they're stable and they're really connected to their kids. And I think the long-term support, the child support has been with us from the beginning of our program, which started back in 1999 with Hennepin County Child Support, led to our success in working directly with child support by having a child support officer on site, working directly face-to-face with dads. Some of the things that Anthony spoke about as far as the experiences that, fathers have had in terms of intimidation and the facility and, just some of the things that they've been involved in. I think child support has really been efficient and effective in collaborating with us, particularly with the leadership of Mark Ponce, who's no longer with Ramsey County, but he's the director who saw the great work that we've done in terms of providing direct services. And I think the whole approach that child support have in working with community-based organizations has changed significantly, where they really want to help fathers and really put them in the position to be able to take care of themselves and, more importantly, be able to take care of their children.
So I want to go around the table and ask you, why does child support matter?
Well, I think child support matters primarily because it's a way to get families out of poverty. There's a lot of kids that are living in poverty throughout the country. Ramsey County particularly has a high poverty rate. There's over 24% of the kids in Ramsey County are living in poverty. That's higher than any of the other metropolitan counties. Mm-hmm. And child support plays a huge role. If there can be steady child support payments coming into a household, plays a huge role in getting kids out of poverty. And we know that there's studies out there that show that kids that are raised in poverty are going to have a harder time in school. They're going to have a harder time throughout their lives being productive members of society and having their needs met. And so I think child support matters in that way. And there's always a healthy tension between making sure that we're doing what we can to get the child support payments into the household. We have some pretty powerful tools that we can use to get child support payments, but they can also be pretty punitive. And so there's, I think, an important balance that child support needs to get at, where we're balancing out what we need to do to get a non-custodial parent, usually a father, in a position where they can pay support, and at the same time making sure that the custodial family, the mother and the child, are getting their needs met financially. And I think child support, just like I said, plays a huge, huge role in family self-sufficiency, getting families out of poverty, getting families off of public assistance, and making sure that they can meet their financial needs.
Melissa?
I would just add that I think two things. One, I think child support is really important for providing families with stability. So if you think about kids who move apartment to apartment or house to house and what that does to their education, what that does to the friendships that they have and the other relationships they have with people in the community, if you can have consistent, reliable child support, you can really make sure that that household the kid is living in hopefully is able to be more stable. Another thing is there's some research showing that child support, $1 of child support contributes more to a child's educational outcomes than other money that's coming into the home. So this money is going directly to pay for those child's needs, and it's really important, again, towards, I think, that stability and what that means over the lifetime, of a child's life.
Okay. Anthony, why does it matter?
It matters because it's the responsibility of a father just to provide for their kids, and to know that when you're giving your money, it's not just out of some, I'm doing it because it's a chore or some. It's because you really want your child to be in the best position possible to have a better life. That's what child support is for. And once you get out that mindset of all the negative things that you think child support or what she's doing or what they're doing, you start to realize that your money is going to bettering your child.
Okay. Guy, what does it matter?
For a lot of the things that's already been said, just echoing those sentiments. But I think, child support took an approach, back during the Clinton administration when, welfare reform, and, you couldn't receive welfare for a lifetime, regardless if you had a minor child or not. So you had 60 months. And I think their approach in working with the moms, because what they realized that the fathers who were in similar positions, and if they had custody of the children, they would probably qualify for public assistance as well. And so they took that into consideration, because as mom is transitioning off welfare and going into the workplace, she was going to need her income supplemented. And part of the reason she was going to need help from him is because he was in a position, not initially, but he needed to be in a position to be able to make a decent, livable wage. But you had to address the issues that he was dealing with to put him in that position to be able to make that decent, livable wage. And so I think they began to understand that way back in their mid-90s, and they definitely understood it as it relates to partnering with the Father Project, in addition to just being flexible with the services they provided us. And I think it matters because fathers have to understand that they have a financial obligation to their child. And if their kids are receiving public assistance, with or without their permission, they have to understand there's an obligation that they still have to fulfill financially. And it's better for them to be equipped with the knowledge and expertise on how the system works, as opposed to ignoring the system and suffering consequences. And when you don't know the system, you begin to have a preconceived notion about the system that it's out to get you, when in actuality it's really in the best interest of the child. And if you supporting your child can help that child come off of public assistance, everybody is better off. The child is better off. The well-being, your stability, the relationship with the mom, the co-parenting, all those things are effective for the family to succeed. And I think child support is misunderstood in a way that when they've worked with us over many years, dad has come to better understand and be educated about how the process works and more likely to work with them together.
You know, it's really interesting listening to you saying that child support has been misunderstood, you know.
Mm-hmm.
But I think that, you know, most of the time or in the past, when we talked about child support, it was lightning rod.
Absolutely.
It was like, you know, and for you to say something nice about them,
Mm-hmm.
that ain't good.
Right.
But anyway, tell us what the Father Project is doing to help families to become stronger and to have those kinds of things that you discussed and talked about.
You know, we're doing so many things. Well, I think we first partner with a number of organization that has a level of expertise that addresses the barriers that these men have trying to be involved in the life of their kids, be it educational deficiencies, be it employment challenges, child support issues, legal barriers that they have, mental health issues, inability to be able to spend time with their children and even know what that means to have quality time with their children, and having the skills and the information to know what it means to know about child development information, early child education, how to make sure that your child is school ready. A lot of these guys, you know, we talk about these men needing to be there for their kid and fulfilling that obligation. But what we don't often understand and what we don't often look at, these men were those kids 20 years ago. These men were those kids 25 years ago. So if they didn't have the proper guidance and direction and the environment and the support and the finances to understand what it means to be a father responsibly, they're just repeating the cycle of poverty, right, in terms of what we know about these guys. And so what we do is we address his needs from the beginning, identify where he is and meet him right there, establish a plan for him as far as what it is that he needs to address to put himself in a position to be able to take care of himself and his child. And then we begin to address those issues by providing services through collaborative partners such as Ramsey County, Hennepin County. We partner with African Community Services. We work with all kind of different populations of folks, from Native fathers to Latino fathers to African-American fathers to Southeast Asian fathers. And so what we do is we try to work with him and help him begin to, first of all, believe in himself, identify who he is, what skills he brings to the table, what it is that he wants to do, and how to help him get there by developing a plan. Secondly, make him understand and realize that by gaining parenting education and parenting skills, that only helps him better connect with his children, better relationship with the mom of his children, better understanding of what her responsibility is as it relates to, because 9 times out of 10, she's the custodial parent, so she got the kids every day. She's dealing with the stress. Sometimes we hear fathers say, you know, if I didn't have my son in my life or my daughter in our life, I wouldn't have had any structure or motivation, so my children gave me structure. Well, what we know, children don't provide structure, they provide stress, right? You know, so, but for some, it's the beginning. But all these fathers, even in spite of the challenges and the obstacles that they face, a good majority of these fathers want to be involved in the life of their kids. And so, you know, oftentimes they make a commitment when they're young, especially if their fathers wasn't there for them or their parents wasn't there for them. They say, you know, when I get older, I can't wait to be much different than my parent was for me, right? So that's the passion, that's the motivation. But that means nothing if you don't have the skills and the resources and the education to be different about it, because you might find yourself doing the same thing, if not worse.
Okay. Trish, how many families are served in Ramsey County on child support?
We have 28,000 cases in Ramsey County. So we're serving about, some of those are duplicates, so there'd be moms or dads who show up on multiple cases, but 28,000 cases.
How much money is collected?
We collect $53 million a year, and sometimes when I'm talking with people, $53 million seems like a huge number. It's hard to wrap your head around how much money that really is. But if you break it down, that's $200,000 every working day. And $200,000, you can look at that in terms of how many school lunches that buys, how many pairs of jeans that buys, backpacks, boxes of Cheerios. That's one of the things that I like to talk to my staff about, so that they feel the impact And it's not dollar amount that's high in the sky that you can't really wrap your hands around, but $200,000 a day, that's a lot of money coming through.
Mm-hmm. Melissa, what is the greatest? I want to use an emotion here, but what's the greatest feeling that you get about doing your work? I mean, because I like I said, I've known you for a while. I know that you enjoy helping families. What gives you the greatest joy about doing your work?
I think for me, because I'm a supervisor, I tend to get the complaint calls.
Okay.
So I get the calls when things aren't going well or people are really unhappy. And a lot of times, whether it's a call that comes to me or a call that's going to the caseworker, child support is a complicated system. And so helping people understand what the system is, how we can work together through the system, how we can resolve issues. As Trish said, we do a lot of we have a lot of tools that we have in our toolbox, and a lot of those tools are things that we are required to use. Driver's license suspension is one of them that we tend to get a lot of calls about, and so working with people to help them get their license back, I think to give people hope. A lot of times you get so far in debt and you feel like, why even bother?
Mm-hmm.
What difference does it make anyway?
Mm-hmm.
So I think a lot of people, when they feel like we'll work with them, we'll give them a sense of hope, and being able to kind of get your life back on track, which is why the partnership with the Father Project is really great, because we can, I think, really work together. And so a lot of, I think, dads who maybe were feeling hopeless, we are constantly talking about Father Project to the clients that we serve, and encouraging them to contact Father Project, letting them know what we can do if they're in the Father Project and they have a Ramsey County child support case. So I think it's helping people with a complicated system navigate that system and have a little bit of hope. And ultimately help the money get to kids and see that children and families are succeeding.
Mm-hmm. So, what do you want to tell the community? If you had a minute to tell the community something about this topic, about the importance of fathers and families, what would you tell them, Anthony?
That's funny, because I got a play called "I'm a Deadbeat Who," and that kind of encompasses everything that we're talking about. It's about a play about, like I says, all the different stresses, all the different things that fathers have to go to get to that point I call it zero, just to start over and to do things. So the play just is there to give fathers a platform to let them know that there's somebody out there hearing their story. They're out there, somebody's out there understanding what they have to go through and removing that stigma of I'm a deadbeat dad, because it's just a heartfelt thing to hear that you're a deadbeat, and when you want to provide for your kids and you don't know how sometimes. That's the toughest thing. So the play is just a narration of all the things that we just talked about.
Did you write it?
I co-wrote it.
Oh, okay.
I wrote
yeah.
and
Well,
produced it.
You'd be proud of that.
Yeah. So I just, I'd be modest about it. Some people have been in the play, hint, guy, and other people, but the play is real good, and it's just really just a snapshot of everything that we talked about. Okay. And I just want fathers to know that there's somebody out there advocating for them, who's been through it, who's understand it, and just trying to teach you what it looks like from a different perspective.
Guy, short, tell me what you...
Fathers will pay. They will. You give them the resources, you give them the education, you give them the information, you give them the support. You be a champion for them. They have no problem fulfilling their financial obligation. And what we've learned by working with child support is they've been flexible with us. They've been passionate about what it is that we do, and they've been supportive about these guys and the conditions that they're in. And they may have made decisions that put them in those situations, but they're also willing to work with those guys as they come out of that. And so these guys will pay, and they want to be there for their kids, and they just want the folks to make sure that they understand that they want and love and appreciate and want to be involved in their kids' life in the best way they possibly can.
Thank you. Melissa?
I would encourage people to contact us. So whether it's by phone or come in person, come to our extended hours events, talk to the Father Project. But our hardest cases are when we don't know where people are, when we don't know what's going on. And our full enforcement remedies start running in effect when we know what's going on, what the circumstances are that people are facing. We can try to connect them to resources and let them know what their options are, whether they're things we can do or things that they may be able to do. But just come talk to us.
Okay, Trish.
I think my last thought would be that the term deadbeat dad comes up a lot, and that's never a term that we use in the child support office. You don't hear us calling people deadbeat dads. We don't think of the non-custodial parents that can't pay that way. And I think it really is a paradigm shift, and we collect the huge amount of child support that's due. We collect 67% of what is due, but there's that other piece that we don't collect, and how do we get at that? And we try to do it, but without being judgmental, and by making sure that we can offer help.
Thank you. Thank you for being a part of our show tonight. Thank you. I hope the listeners that you've had an opportunity to hear and to learn some new things. And if you're in that situation where you need some help from Ramsey County, what's that number again?
Our child support number is 651-266-3344.
All right. Thank you. Have a great evening.
Thank you.
Thank you.
Thank you for listening to Community Health Dialogue, sponsored by North Point Health and Wellness Center. Join us next Monday from 6:30 till 7 for more discussions for a healthier community.